Good morning, doctor, because a healthier you begins with Parkway Shenton. Let our family doctors support you with quality and affordable care as your lifelong healthcare partner.
Waking up Singapore.
Can I get up?
The Big Show on Kiss 92.
Can I get up?
Good morning, Singapore, and welcome to The Big Show. It's Glenn, Daphne, and the Flying Dutchman. Angel's taking a break today because she's got a full day of work outside of the studio. Our guest for today is Dr. Ethan He, General Practitioner from Parkway Shenton. Good morning, Doctor.
Good morning. It's good to see everybody again.
I know.
Nice to be with you once more. Thanks so much for coming down. Today we're going to be talking about lung health and checking one's lung health. But before we get into that, if we could spend a couple of minutes talking about Healthier SG. Could you explain a little bit about what it really is?
Okay, so Healthier SG is basically a national-wide initiative from the Ministry of Health, MOH. So the whole idea basically is that, it's very important that, you have a family physician who's looking after you, from cradle to grave. Because, especially if you have a family physician who knows you and knows your family, they will identify risk factors. They have more time to get to know you. It's not just I've got cough and runny nose, I'm here to see a doctor and just settling the acute issues, but really to follow you along, to know about your family. And in the process, if along the way, you can discuss about preventive medicine. If you have chronic diseases, it can be managed better.
Yeah.
It's about basically treating you as a total person, rather than just treating a problem itself.
Yeah.
So the whole idea is basically to have a doctor following you all the way from cradle to grave.
It's ideal, actually. Yeah, because your family physician is part of your family.
Exactly.
And I think it's very important, and correct me if I'm wrong, a lot of people in Singapore don't have that family physician. They go from doctor to doctor to doctor and then no one doctor has their complete history.
Yes, exactly. So what happens most of the time, and what we see as well, is that patients do tend to doctor hop as well. Sometimes they see a doctor nearby for their for their acute conditions, like maybe they're down with flu, and then they might see another doctor for chronic illnesses. And sometimes this can actually have some issues. I mean, if you have a doctor that follows you all the way, at least he's aware of all your past medical history, right?
Of course.
They know that what are the medications that you're on, and most of the time we do see that patients, especially those with chronic diseases like like blood pressure or diabetes and all, they tend to forget what medications they're taking, and then it takes a while for us to try to find out what medications they're taking. So it's always good to have a regular doctor that you're seeing as well.
Actually, I
Stick to one doctor.
Yeah, stick to one. What I do with my medications, for example, because I'm on heart medications, right? I actually have photographs of all my medications in a file on my phone, so that if anything happens to me, even family members who have the passcode to my phone can open up my phone and show people what I'm on.
Right.
That's very responsible of them.
In case anything
In case you
happens.
lose your memory, or
No, in case I'm involved in an accident somewhere or something, so they can that they can get
But it's good to have,
Yeah, it's good
even
to have it on.
Even if you go to a doctor or a new specialist, at least you have that information. You're not going to miss out. But I think what the Dr. He is saying here is that when you go and see a new doctor, sometimes you can give them all your symptoms, but forget that you're on certain medication. It's easy to forget, especially if you're on a bunch.
Yeah, absolutely.
Yeah,
okay,
that's right.
let's get in today's topic of discussion,
Yeah.
which is lung health.
Yep.
So, how often do we need to get our lungs checked?
And what is a lung check?
Yeah.
Okay. Well, that's a very interesting question. So basically, I mean, the most common thing, of course, concerning our lungs and our airways is, of course, the usual run-of-the-mill flu, right? So every time you're down with cough and runny nose or a bit of a sore throat, that's usually the time that you see a doctor and get your lungs checked. But I think also most important, other than that, of course, we have the common airway illnesses, like, for example, asthma.
Yeah.
And you also have smoker's lung, which is a chronic obstructive pulmonary disease, which is COPD. So these are actually the more common things that, we get our lungs checked. But I think also at the same time around, I'm sure there are many, individuals that are also concerned, look, doctor, I've been smoking for a considerable amount of time. Then there's always this discussion about, do I need to get myself screened for lung cancer as well?
Right.
But if you are a smoker, that should be a regular screening anyway, shouldn't it?
Oh, you'd be surprised. So I shared with Glenn and the Flying Dutchman before, but my dad passed recently of small cell lung cancer. And as a smoker, the last thing he wanted to do was go to a doctor because he knew that probably whatever he found out, he wouldn't want to know, so he literally waited till the last minute to go get checked.
So you kind of suspected there was something.
I'm pretty sure he just knew because he was a chain smoker. He just
Okay.
is never seen without a cigarette in his hand.
Yeah.
Okay, let's talk about this for a minute. We all say if you're a smoker, it leads to lung cancer, correct?
Right.
Is that the only way?
Hold on. We'll continue this conversation on The Big Show TV. Ava Max is next. $1 Million Baby on Kiss 92.
Okay,
Okay.
so we all connect lung cancer to smoking, and rightly so. But is that the only way you can get it? The reason why I ask this is it hereditary? Are there other ways of getting it?
That's very fair.
His mic is not.
Yeah. Okay.
Okay, yeah. So that's a very fair question because, historically, we always know that lung cancer is always associated with smoking.
Yeah.
But certainly, there are things that have changed. To quote some statistics, there were 2 studies that was done at the National Cancer Center back in 2006 and also in 2018 as well. Now, in 2006, they found out that so as you know, lung cancer has 2 kinds of lung cancers. One is the small cell lung cancer, and the other one is the non-small cell lung cancer. So we know that they are all both associated with smoking, but not as one of the only risk factors.
Right.
So for 2006, they found out that 32% of non-small cell lung cancers were actually non-smokers.
36%.
32%.
32%. That's pretty high
And-
still.
And about 10 years later, that number has actually increased quite significantly by
Right.
about a third to 48% of non-small cell lung cancers being non-smokers.
So what do you think? Do you think it's
What's
other forms of
causing-
nicotine or tar that's getting into their bodies, or what could be obstructing their lungs?
Correct.
If it's-
So because we know that smoking is one of the risk factors, but we're beginning to appreciate that it's not just smoking. There is a risk factor for lung cancer. Passive smokers, okay, that means those around the
Right,
family.
secondhand
Secondhand
smokers.
smoke.
Yeah, exactly. Secondhand smoking. Those who are working in industries that have a lot of air pollution.
Right,
okay,
like
as-
miners and stuff like that.
Yeah, correct. So like
construction.
maybe exposure even to things like diesel fumes, asbestos previously.
Well, yeah, asbestos, yeah.
Heavy metals like nickel. Okay, soot as well. So even the air pollution, if it comes over to Singapore as well. So all these things, especially involving fine particles of PM 2.5 and
Yep.
below, we do see that there's a correlation.
Yeah.
Now, of course, another thing that I commonly see in clinic as well is some patients will come and ask, what about family history? Like, I've got a father or uncle, that has it. So what about me? Am I at
Is it
risk?
hereditary? Yeah.
Exactly. So the data for this is actually a bit varied. Okay, internationally, some countries quote about 5% of lung cancers being hereditary. Some quote up to about 15%, 1/5.
Wow.
Yeah, but I think generally in Singapore we do see that the majority, quite a overwhelming majority of lung cancer cases are actually acquired, which means that it's actually from the environment or from whatever habits that you've been having, rather than hereditary.
Yeah,
Right.
I would
Okay.
say 15% and 5% is a very loose. Like that's not much to hold on to.
Yeah.
Yeah.
I believe we should live our best lives, live as healthy as possible. But if it's your time, it's your time.
I mean,
Yeah, that's-
enjoy your
yeah.
life.
You know what I mean?
basically.
Because you can spend your entire life worrying, and you'll end up sick. Because the mind is also a very, very powerful thing.
Yeah.
I suppose.
I've had a friend who had nothing, okay, but because his family had a history of various ailments and all that, he spent his entire life trying to do the exact opposite of what his family members were doing, and that includes diet and so on.
Right.
And just worrying. At the back of his mind, he was always like, the next time I go for a health check, something's gonna crop up.
The funny thing is, you can be healthy as a horse,
Yeah.
do all these things, and still get sick.
Exactly.
Or you could be like my dad and just completely enjoy your life
Right.
up to the very
Yeah.
end.
Yeah.
And he just, he had a wonderful life.
We're not encouraging
No, we're
No,
the
I'm
not.
smokers
just
to
saying-
continue to smoke.
Yeah,
but
Yeah.
for sure. And actually, to that point, is there something we can do about smokers to get them to stop? Or, not in the same vein as enjoying your life,
Right.
but is there anything we can do? Because there's no, do we have nicotine gum? We know we have patches
We
in
have
Singapore.
patches. Yeah, patches.
We don't have because gum is not, we can't have gum in Singapore.
Because
right?
there's a school of thought, right, among the smokers that if they quit smoking, they'll die even faster.
Oh,
they'll get
please,
sick.
please dismiss this theory, this mindset.
Well, I mean, I can't comment about this one, okay? But well, I mean, in terms of quitting smoking, and this actually ties in back to Healthier SG as well, because, usually what happens is when you go for your first Healthier SG consult, what happens is we'll take a full history and try to find out a little bit more about yourself. And certainly smoking is one of the history, one of the past medical histories and details that we need to get from you. Now, I mean, in the end, when we talk about smoking cessation, it's actually more complex than just giving you nicotine patches and all. I think it really starts from yourself.
Yeah.
You have to, even contemplate considering to quit smoking, because no matter how much we nag at you and trying to tell you about the dangers and all about smoking, I think in the end, it's really about yourself. And you must reach that point in time that you feel like, okay, I may want to give it a try. Because it's very hard, and we do see statistically that those who do not even have that contemplation or even have the initiation to move on from, trying to quit smoking, they tend to relapse back to smoking quite quickly.
I was a 2-pack a day smoker.
And you quit.
And he gave it up just like that.
I quit when I was 40, because when I decided I was going to go for my yearly health checks.
Wow.
I thought to myself, oh my God, I don't want to
bad news.
Yeah, exactly, right. So I quit immediately.
Like cold turkey.
Cold turkey.
Yeah,
Oh.
it was crazy.
Yeah.
That
he
is
couldn't believe it.
insane.
He lost. He lost. Both of us we used to go to the
corner.
smoking
smoking
area.
area.
And while I
I'm so
smoked,
proud of you.
he would talk to me.
lost one of my cookies.
Yeah.
I'm so sorry, but I'm so proud. It's so
It's
hard.
brilliant. It's absolutely brilliant.
All right, 5 seconds.
Okay, going back on air.
Oh, traffic.
Kiss 92 traffic.
So we've got the usual delays across the expressways, and that's not going to surprise you too much. Just please stay within the speed limit, have everyone buckled up, be safe as you drive today.
Welcome back to The Big Show and The Big Show TV. It is Good Morning Doctor Day, and we welcome General Practitioner from Parkway Shenton, Dr. Ethan He. Good morning, Doctor.
Good morning.
Okay, Doctor, I want to ask you something because I've seen this on my feeds quite a lot recently. There are so many people who are advertising these sprays and these pumps that are going to clean out your lungs.
What?
No way.
As in
Like a
vaping.
purifier?
No, pumps that you spray into your nose and whatever, and it's going to clean out your lungs. Can you please tell people this is absolutely rubbish? We really can't clean out our lungs, can we?
Well, our body can clean out our lungs ourselves. I think that's the most important.
Yeah.
But we need to go somewhere with fresh air to do that, right?
Yeah, exactly. So I think really it comes down to, avoiding the things that are really causing, these kind of, disturbances to our lungs.
Right.
So certainly, like for smoking,
Yeah.
or even for occupations that are exposed to fumes,
Yeah.
or fine particles, certainly these things, once they get inhaled into the lungs, especially when they go into your air sacs, okay, it's going to be very difficult to pump it out because what happens is, these fine particles are actually attached into the walls of your alveolus, which are your air sacs, okay, and some of the times, they actually get absorbed into the layer as well, right? So it's not so easy as saying, just pumping it out, with
Yeah.
a mechanical
With the
instrument.
with the squirt nose squirt.
Yeah,
Like the sinus ones I get because it's your nose, right?
Yeah.
But your lungs?
Yeah,
Nah,
yeah,
come
oh,
on.
yeah. I get it all the time.
So I mentioned vaping just now. So
Yeah.
we're talking about vaping because many people vape these days, although it's illegal. I see it all
Yeah,
the time.
totally.
Yeah.
So vaping versus smoking, which is worse?
Okay. So I think we need to firstly establish that vaping is illegal in
It's
Singapore.
very illegal,
Absolutely.
And one of the biggest problems with vaping, and even the CDC has acknowledged that as well in America, is that the data is still coming in, and we still do not fully appreciate the extent of the side effects and the health complications that may arise from e-cigarettes or vaping. Now, back in 2019, actually there was a moment in time somewhere about 2019, so that was pretty much before the peak of the pandemic itself, that they were actually beginning to report this condition called EVALI, which is EVALI. So it's basically e-cigarettes and vaping-associated lung injuries, okay, amongst the young.
Of
And they were
course.
coming in into
Singapore?
no, in America.
Oh, okay.
And they found that basically it was associated with two things. Okay, one of them was something called a vitamin E acetate, which is an additive that's added into THC e-cigarettes. So THCs are basically cannabinoids. They are found inside e-cigarettes as well, and they were leading, young individuals to basically, get breathless very quickly. They
Wait,
might
there's
need-
THC in the e-cig.
Exactly, in the e-cigarettes as well. Yeah, and so it was actually leading to individuals being hospitalized. They require high dependency, sometimes even ICU, because their lungs were not compliant and they were scarred by the entire affair. So this was actually just isolated to just 2 chemicals alone.
Whoa.
Yeah, but we do recognize that, especially with e-cigarettes, that there might be more things because, it's not, admittedly, yes, there's less chemicals in an e-cigarette rather than the conventional kinds of cigarettes that are commercially available.
Right.
However, they are not spared of heavy metals like nickel. They are not spared of fine particles. They are 2.5 and PM 2.5 and below, and certainly nicotine as well. Okay, so the
Right.
nicotine content may actually be higher in e-cigarettes as compared to conventional cigarettes as well.
So it's just as addictive, right, as cigarettes, I would imagine, because of the nicotine.
Correct.
Yeah.
Yeah.
Let's talk a little bit more about vaping, and I'm also going to be asking Dr. He this question: what are the signs of lung cancer?
yes.
All right, we'll talk about it a little bit more on the Big Show TV. It is 8:16.
Kiss 92 Time Check brought to you.
That's
so
crazy.
Speaking of vaping, I think in America at that time they had this huge marketing campaign, made it look so cool and all that, and that's when the
Really,
young ones
when I
started.
lived there, all I heard was that this thing could blow up in your face.
Yeah.
because they
Because
had
it
this,
did.
Yeah, for a couple people, but that was from and a lot of people were having issues because they had the refillable ones. I don't know. I never. My friends and I in the States, we don't use it, but what I heard and what I read in the articles is the ones that they refill. A lot of people were selling fake ones. That's why the
Oh.
chemical. It gets hot and then
Yeah.
it just exploded, I guess. So that they were saying like don't buy the refillable kind. I didn't even know what it looked
I
like.
thought all vaping devices are supposed to be.
I don't know.
No, you have
Some are
your single
different
use, you
ones.
have your multiple use.
Right.
Yeah, correct.
Either way, I mean, the thing is, you're saying that the reason that it's illegal or the reason Singapore hasn't brought it in is because we don't know all the health potential or what it could do.
Yes, correct. So I think partly is also because the long-term side effects of vaping is still not known, although there are already reported complications even in very young individuals because of vaping. Yeah.
But why are these young individuals doing it though? They're just getting their hands on it and then they're like, here, I'll do a survey.
Exactly.
Like-
I think the same reason people still continue to smoke.
Okay. In Australia, they did a survey. They've banned vaping in Australia as well, the sale of vapes, except through pharmacies. And it was because a lot of these vapes, especially the flavored vapes, were put right alongside sweets.
Oh no.
They had kids in Australia, 6 years old, vaping, thinking it was a sweet.
That's terrible. And that's
That's
nicotine.
how bad it got.
Yeah.
And I think another issue is also that most people do not recognize how much nicotine actually gets in for a single tube of, depending on what you're using as a vaping agent. So usually if you were to smoke a conventional cigarette, you kind of know, okay, this is just one stick and I'm done. I'm going to open another one. So
And you have to go to a designated area to do it.
Exactly,
In Singapore.
exactly.
Yeah.
But when it comes to vaping, a single refillable tube, for example, can basically be equals to about 1 to 2 packets of cigarettes worth of nicotine,
Yeah.
which you may not be aware of because you are basically smoking from the same joint.
Yeah, that's
and you
insane.
can just continue going on and on and on.
Smoke.
And
Literally.
You may not
Holy
be aware.
Sorry. Yeah.
But also, okay, because of all of this, wouldn't you think it would be better that I'm not saying to legalize it, but at least then you can mandate the age and who is allowed to have these? Wouldn't it be if we just slapped rather than be like completely illegal, which might make the younger people be like, oh, as long as we do it at home, nobody knows, it's fine, or like for me, I don't know, I'm looking at like, Thailand with cannabis and such. At least you're regulating who gets it. You're like, gotta have your ID when you come in and stuff like that,
But you're talking about Singapore, is it?
I'm talking about Singapore with
So
the
I
vaping.
think if there's any country that can do what you just suggested,
It is
it's Singapore.
Singapore.
But as Dr. He just mentioned, right?
We don't know
This
enough.
vaping thing is still rather new, and so I don't think our health sciences authority is going to
Are ready to.
Yeah, because that could be really, really bad repercussions.
I mean, even
in
before
the
we
long
talk
run.
about all the harmful chemicals, let's just talk about nicotine, especially high doses of nicotine, because now smoking has been pushed to 21. as a
Okay.
legal age to start. So high doses of nicotine, because our brain develops all the way until we are age 25.
Right.
And so nicotine, especially with, continuous usage of it, it has been shown, especially in the youths as well, to affect many domains of brain development. So
see.
one of them could be your emotional, okay. Another one could be your concentration, which is a very big problem because we're such an exam-oriented society still.
Yeah.
It can affect, memory, so trying to remember facts at all, and attention and impulse control.
See,
Yeah.
this is why I don't date guys that smoke because they all don't have any. When people ask, this is why, okay?
And
We all just laugh only.
we were talking about the younger generation, right? Early on,
Yeah.
you remember when we were all in our
Youth.
in our teens. You just
Yeah.
felt invincible. It's like nothing can bring us down. And
Oh,
so
but I never
so-
touched a cigarette in
Yeah.
my
Good for you.
teens, in my 20s.
Good for you.
Only when I was waitressing in uni because all the smokers got a break. And I was like, I am busting my behind here at work, and all I need to do is smoke so that
This
I
is
can
in the
take a
States.
break. This is in Australia.
in Australia.
So I bought a packet of cigarettes, and I would not. I hate cigarettes. I hate smoking. I would just go there and hold it. I would light it,
Yeah.
and then I'll wash my hands vigorously after. But I got a break.
Such a good girl.
But it's terrible though. But it was the way I was like, how are these people? And sometimes they leave 10 minutes, 15 minutes.
No, it could also be because when you were growing up, your father was already smoking, right?
Yeah, and
so you
that's
didn't
why-
like the smell, and you didn't like the whole.
Yeah, do you know cigarette smell?
process.
I still associate it with my dad. because-
It's interesting that you say that because as much as you were doing that to take a break, you were exposing yourself to
to
secondhand
secondhand
smoke.
But I was so used to it
Who
already.
knew about secondhand smoke
At
back
that
in
time?
the day?
Yeah, exactly.
Back
No,
in the day.
I knew it was wrong because my mom, we all tried to get my dad to quit, as we were growing up.
Yeah.
We would buy him those like hypnosis tapes and stuff. He didn't listen to any of it. But he tried. He probably tried his darndest, but he just couldn't, he couldn't quit. But yeah, to me, I didn't even think about how secondhand smoke was maybe affecting me, but I knew that my mom was aware of it because she would always, say, go outside and smoke. I actually don't know if she knew the repercussion or the fact that she just didn't like the smell. But yeah.
I remember stealing my father's cigarette when I was in primary school, thinking, oh, it's so nice and cool. So when they were out, I found a cigarette at
How
home.
much did you cough?
I went downstairs and I lit it, and I'm like, oh my God, this is the worst thing ever.
Terrible. Well, how do
And
you?
then never
How do
again.
guys go from that to like wanting to smoke?
Because you
Exactly.
want you want to be part of
Oh,
the pack.
group.
I only started smoking again, when I joined the entertainment industry. I'll tell you a little bit more later. Okay, stand by. We're going for a traffic break. And then, Doctor, we'll talk about signs to look out for lung cancer.
Karma's gonna hold you down.
Kiss 92 traffic.
So we've got the usual delays across the expressways this morning. The TPE towards the SLE, vehicle broken down after Tampines Road exit. PIE towards Changi, vehicle broken down before the BKE. PIE towards Tuas, a vehicle broken down after Adam Road. SLE towards the BKE, a vehicle broken down after Lentor Avenue. KPE towards the TPE, an accident after Buangkok Drive exit. Please stay within the speed limit. Have everyone buckled up. Be safe as you drive today.
Good morning and welcome back to Good Morning Doctor. Every Wednesday is Good Morning Doctor, and this week we have Dr. Ethan Her, general practitioner from Parkway Shenton with us, and we're talking about lung health. I mentioned during the Big Show TV that I'd be asking the doctor this question, and this might be a bit disturbing, right? Because everyone is like guessing. I mean, someone who's listening in right now may be having a little bit of a breathing difficulty or
Some anxiety.
or because they're a little worried about certain things,
Yeah.
might be feeling a little breathless as well, and they're thinking,
choice.
am I having some lung issues and all
Yeah.
that. So on a more serious level, what are some of the signs to look out for lung cancer?
Okay. Of course, it's good to have a bit of a disclaimer that, whatever symptoms that we are whatever symptoms that we're having, it's not necessarily associated with cancer.
Of course.
Right.
Yeah.
It's
Now,
like
of course, one of the more common things that we tend to see is, of course, a chronic cough. We're talking about cough that can last 3-4 weeks and even longer than that.
like dry or
It can be like dry or productive. It doesn't really matter. So it can be phlegmy, it can be dry. It doesn't really matter. It can be a very, baseline kind of cough. It's not getting worse, or it can be getting worse as well. Okay.
but as long as you've just had it for a long time.
Exactly.
But of
So-
late, many people have been getting this cough that
there's
lasts
also that
for
post-COVID
for weeks.
cough. Yeah.
Yeah, correct. So that's why it's very important, that especially when your cough is a bit protracted, it's very important to see a doctor.
What's
okay,
protracted
and,
cough?
meaning we're talking about 3 to 4 weeks worth of cough, that doesn't seem to go away. Now, common things are still common. I think that's very important to recognize. So the most common cases, and like you rightly say, we're seeing like post-COVID as well, or even after a typical kind of flu episode, that people are having cough that can last up to 3 to 4 weeks. Now, as I say, common things are common. So most of the time we do see that it's probably just a bit of a post-nasal drip. People getting a little bit more hypersensitive airways. For the slightly obese or overweight, it could be because of reflux as well that can be causing the cough to last a longer period of time. So they are still the more common things. But of course, if the cough lasts for about 3 to 4 weeks long, we will usually consider whether to do an X-ray, to take a look at your heart, to take a look at your lungs and to see whether everything is all right. So that's one of the symptoms that lung cancer can present. Now, another thing would be shortness of breath, or even reduced effort tolerance, meaning that, even baseline, you feel like you're getting more and more breathless. There might be episodes that you might be coughing out blood. And other constitutional symptoms like losing your weight even though you're eating fine. You may be losing your appetite as well. You may be feeling more fatigued and more tired recently. And depending on where the cancer is as well, you might start noticing that there might be some change of your voice. You might get some pain, especially when you inhale, depending on where the cancer is, or the pain can be on your chest, it can radiate to your shoulder, it can mimic a heart attack.
Is this at the point of past the point of no return already, or is this just symptoms still?
It's very hard to say. So usually in such symptoms, we usually would start investigating, and depending on what we see, we need to stage the cancer, and we can see where we can go from there.
Yeah, that's why some people, when they get checked and all of a sudden they discover it's like stage 4.
That's the
it's so
worst.
sad.
Yeah.
I think the other thing we need to realize is that smoking doesn't only lead to lung cancer, although we're talking about lung cancer now. There's throat cancer, there's cancers in your mouth.
Tongue,
It can happen through many different parts of your body, and smoking is one of the causes of that. We did have
I think
someone...
smokers are a bit weird, I say. Some of the smokers I know, when they have terrible coughs, right, they continue to smoke, but menthol cigarettes.
But you gotta love their character.
Yeah, right?
You
It's
gotta
like-
love their character.
It's
My dad went to menthols and smoked twice as much. I say you're defeating the purpose, Dad.
No, but is there any way of treating lung cancer? I mean, we all know that we all have this fearful word, chemo, but in the early stages, is there any other way to treat it?
It's
certainly.
immunology.
So the treatment differs if you're looking at non-small cell lung cancer versus small cell lung cancer. Now, small cell lung cancer, the treatment usually, regardless of which stage is it, we are usually looking at either chemotherapy or concurrent chemoradiotherapy. For non-small cell lung cancers, things may differ. So usually in the early stages, we can discuss about surgery. If surgery is not an option, we can also talk about curative radiotherapy as well. Okay, and of course, but unfortunately, as the stages progresses, you might need to start talking about, maybe neoadjuvant chemoradiotherapy, neoadjuvant chemotherapy, then followed by, looking at restaging you and seeing how things go before the next stage can be decided. Now, but the good thing about lung cancers in general, especially when we talk about non-small cell lung cancers, is that the science behind it is changing. So now we're beginning to recognize that there are many markers that we're looking at that actually can help to determine prognosis, and also with lots of targeted therapy that's available.
Right.
So, I mean, just thinking out of my back, things like EGFRs and ALKs, PD-L1, all these kinds of receptors that nowadays when we do a biopsy, we actually send for all these biomarkers and to look for any particular receptors that are positive, because we do have targeted therapies available for them,
Right.
and they do affect prognostication as well.
Yeah, and this is just all to say that there is a way to target exactly what's wrong in your body. So these markers, if you use a blood test, right? I'm assuming, or
from the tissue
biopsy.
sample, yeah, from
Okay,
the
got
tissue
you.
sample
Yeah,
itself.
just
So speaking of all this, I mean, tests and all that, so how can Healthier SG help those that are suffering from lung health related conditions and want to go for a
Test.
health check. Yeah.
Okay, so smoking was one of them. So
Okay.
really, it's about seeing a regular family physician and trying to, discuss about smoking cessation if possible, or either that or we'll nag at you and to
And they can
advise
book
you
an
to stop
appointment.
otherwise. Yes.
Yeah, they can book an appointment on Healthier
Yeah.
SG.
Exactly.
Yeah.
And of course, that lingering cough that you're having from a flu, I think that's very important. Try not to doctor hop too often, because every single doctor, that's seeing you for the first time, they may not know what's going on and what are the medications that were given to you previously. So it's probably good to stick to one so that at least the workup can be more complete. Certainly smoking, lung cancer screening, it's a shared decision. So I think it's very important that you have to discuss with a regular doctor that you trust about whether you want to do screening. I mean, especially when you talk about secondhand smokers.
Yeah,
Okay.
yeah.
Because it's a shared decision. And it's not as simple as just referring you to a specialist to get a scan done. Most of the time when patients go for scans, we can detect things called in the medical fraternity we call it incidentalomas, which means that there are always little nodules everywhere.
Yeah.
It may not be anything, but it can cause
Alright.
panic as well.
Yes.
So please be aware of that as well.
Yeah.
It's not just as simple as going for a CT scan.
Yeah.
Yeah.
Well, thank you very much, Doctor, for joining us today. It's been a pleasure having you on the show once again. And I think we've learned a lot this morning. As we
Yeah.
always do every week on Good Morning, Doctor. Thank you so much, Doctor.
Thank you for having me.
We've been speaking to Dr. Ethan He, general practitioner from Parkway Shenton.
Thank you for tuning in to the Big Show's Good Morning Doctor, because a healthier you begins.